Hey everyone, welcome to Movement and Mobility. My name is Dr. Jessica.
And I'm Dr. Tiffany, and today we're going to go over some great stretches for low back pain and neck pain, and even some simple things you can do while you're at your desk.
We really actually want to start with some things to help your joints because we know that joint mobility is going to be the key to a lot of things. And so let's talk about stiff joints and some of the causes, Dr. T.
So sometimes if you've ever been that person where you wake up and in the morning you feel very stiff, your low back, your neck, even sometimes it could be your elbow or your wrist.
Oh, yeah.
Stiff joints are very common. At some point, we'll all experience a stiffness. It can be caused from years of arthritis. So overuse, osteoarthritis is usually when we have some overuse. So it could be caused from that, also with pain. Overuse can be ultra runners, marathon runners, people who run for a long period of time in their lifetime, decades even. Those repetitive motions. So even though I just mentioned running, a repetitive motion could also be someone like who makes cabinets or someone who works on cars, say someone who has a screwdriver and they're constantly fixing things. They can also get, because that repetitive motion, they can get arthritis or even tendinitis in their elbow. So what I'm explaining is a form of tendinitis. And then also injuries. So when you have an old injury and, I'll leave it alone, it'll get better. What happens is there's scar tissue that lays down, and then your joints will become, they'll get stuck or they won't move and they'll become stiff over time. And then it could bring up pain later in life. So a previous injury, and then also something we all do probably for a little too long is sit. So poor posture can also make your joints very stiff. So it's very important to take breaks from repetitive motions and also sitting too long.
So let's talk about some things that we can do to start helping our joints become more mobile. So we want to talk about supplements first because these are things that we can easily add in, especially with nutritional things. So the first thing would be a bone broth, something that has collagen in it because this is going to be good for our joints and will help support them and add elasticity to things. Omegas are also really good because think of this as lubrication for your joints. So we get actually a lot of omega-6s in our nutrition and our diet. So we're looking for omega-3s. Omega-3s are anti-inflammatory for our body, so will help decrease inflammation. And like I said, it really is a great lubrication for your joint.
Omega-3s are commonly found in cold water fish, fish that isn't farm raised, those nice fatty fish like salmon, sardines, anchovies. They're also found in chia seeds and walnuts, some fatty nuts.
There we go.
So even just adding that into your diet is helpful. When you already have stiffness and pain, it's definitely good to add in these supplements as well. The reason why you want to add in omega-3 instead of omega-6 is because you get lots of omega-6s through just our poor diet.
Yeah.
So you definitely want to add in the omega-3s to offset that ratio. The next thing is hyaluronic acid that is found in our supplement called Joint Health. Hyaluronic acid is basically like the cushion to your joints. So if you think of like your knees and your elbows, it definitely can help you repair as well.
Even your discs?
Even your discs, yes. The discs in between your bones and your spine. And then Joint Health also has a few extra things in it. Boswellia, which also is an anti-inflammatory. It's really good for osteoarthritis, rheumatoid arthritis, bursitis, and tendinitis. All the itis, which basically is inflammation. It also has gingerols, which are anti-inflammatory, and collagen type 2. Collagen is what helps you make and repair your tendons and ligaments. And then the last thing on this slide is the magnesium lotion. We love this stuff. We personally have been using it. I know I've used it on my knees with a lot of running I've been doing lately.
Oh, yeah.
You've used it on your elbows. So the magnesium lotion is awesome because magnesium helps relax your muscles. So it's good to use on any muscle in your body, but particularly in your joints because it helps your ligaments and tendons relax as well.
So the next thing we want to talk about is chiropractic care and how getting your spine adjusted can actually help with things. So when we think about the spine or you think about any joint, right, there is a muscle and there's bone and there's ligament in that area. What can happen is your muscles or even your bones will get locked up where there's not a lot of motion. And so by getting adjusted and putting motion back into the area can actually free that area up. So this is what we mean when you can unlock some stiff joints. When you get more motion into said area, so let's say we're talking about the low back, and we get your low back adjusted, you're actually helping to create more space within your disc. You're unlocking the bones above and below that disc space, which means more movement and mobility. Therefore, all the muscles that are attaching to that low back can also be free, and therefore we get reduced pain in that area. And when you're getting adjusted, also we can help improve just mobility of every single joint in the body, and then also just improving your balance as well.
I mean, we so commonly see people who get adjusted and then they also can walk better, and they have better balance, whether they're playing a sport or even just in their everyday life, which is great. Next is low back pain. So we're going to go over some stretches specifically to your low back, but a lot of low back, I mean, at some point, everyone will experience low back pain in your life. That is a research fact. It's just at what point in your life. So it can come from a number of things. Some are damage to the discs. So the discs are the space in the cushion in between each bone of your spine and your low back. You've heard of a herniated disc. That's not good. So if you have a disc still there and it starts to bulge or herniate, you can certainly pump that back open. One of the best things you can do, which is simple, is drink lots of water to help rehydrate that disc. The next thing is compression of the nerve roots. The nerves actually come out just behind those discs. So if the disc does start to bulge, it's going to irritate that nerve root as well. If you've heard of sciatic pain, that is when that nerve root is very irritated, whether by the disc or even when it passes through muscles in your glutes. Improper movement of spinal joints. So people who maybe do a lot of pushing, or people who I'm thinking of, like people who have to do a lot of lifting of heavy things, and or movers, even people who help people move their homes and their furniture. They're bending over a lot. So that's can be improper biomechanics and also muscle tension. So muscle tension in particular, that is what we're going to go over for your actual stretches today. To release some muscle tension is going to be helpful with stiffness and pain, because those muscles also attach through a tendon, which attaches the muscle to the bone. And at that location is where you want to open it up, stretch it, and really get that end range in those stretches.
All right, so here are some stretches for y'all.
So if you have back pain on one side or the other, sometimes the opposing hip flexor in the front can be very tight. It is important to always stretch both sides, but sometimes you want to focus on one side or the other depending on the pain. So for example, if her pain is here on the right, she will go ahead and stretch in the front on the left. Now turn towards. Stretching right here in the front. That is her hip flexor, also known as her psoas muscle. And you're going to hold it for about 30 seconds at a time, staying in the lunge. And again, go ahead and do the other side just to be even and balanced. And you'll notice sometimes one side is definitely tighter than the other. So the stretch we're going to do now is called pigeon. When you have low back pain, it can also be because of different tight muscles. This one is going to be for your glute muscles, okay? So whatever side's tighter in your low back or even in your bottom, you're going to put that leg up on the chair and you're going to slowly lean into it. Be careful with your knee if you have knee issues, but what she's stretching is right back here and along this leg and your glute right there. So you'll hold it for 5 seconds and you'll do about 5 repetitions of this at a time. The next difficulty is you can do this on the ground. So she has, this is the affected leg. She's stretching right here for her bottom there. You want to try and keep your hips nice and even, straight across, while bending this knee to take some pressure off your knee. Hold it for about 30 seconds. So
all right, so hopefully y'all learned something with that. Definitely make sure that you can pause the video, rewind, do some of the stretches with us, because that's how you're gonna start to relieve that low back pain. And now we want to just mention some of the muscles that are attached to that area that we think absolutely contribute to low back pain. And so the first one is going to be your hip flexors. Your hip flexors are actually on the front side of your body, right? And they attach from, if you can see this picture, from the spine down into your hip joint. They are a muscle group that really helps actually lift your thigh up to your torso or bring your torso down to your thigh. So these muscles can actually get tight when you are sitting behind a desk for a very long period of time.
absolutely.
And most people don't realize that that tightness and tension actually contribute to low back pain. Twins. All right, so some other things is when we have tight hip flexors or even tight low back muscles, right, your body starts to compensate in different patterns to create pain. So this is why we wanted to talk about the hip flexors, because not a lot of people realize that even though it's on the front side of your body, it can absolutely contribute to that low back pain. And then your body's actually just compensating by creating pain in that low back.
So I challenge you, this is something you can look at, is if you have one-sided low back pain, not that shoots down, but just kind of above your hip area. So say I have low back pain on the right. If you go and feel the front of your hips, in front of your hips where they bend, where you have that bend, the opposite side on the front side will actually be tighter. And you just kind of poke it, put some pressure on it, and you can tell the difference. So like I said, if it's right-sided low back pain, usually the other side of the hip flexor will be tighter. So go ahead and check that out, and you'll be amazed. That's usually the common demonstration of that.
Sciatica. Dr. T just talked about this one a little bit, but we feel like it's important to hit because a lot of people come into the office with sciatic pain, and we just want to explain it to you because some people just don't understand exactly what sciatic pain is or where it comes from.
So I'm going to explain the pictures to you just so you know exactly what we're looking at. The first one with the person's body, you can see that the sciatic pain is actually made up of 3 nerve roots that come from your spine, and then the blue part is the sciatic nerve running down your leg. It does go down both sides. It's just being shown on the right. Commonly where people feel it the most, they'll feel it in their glutes when they have tight glute muscles on their bottom. And then if it's really bad, you'll feel it run down all the way down your leg. True sciatic pain is the pain that runs down all the back side of your leg. There are other nerves that go down the side and also in the front, but the true sciatic actual nerve does run down the back. Now to explain the other pictures to see what you're looking at, the one on the bottom is a view of your low back from the side. So as if this person's turned, with the arrow, this would be the front of their body where their stomach is, and then the back of their body is where I have the arrow now, behind these bones right here. Your spinal cord is what runs down. That's what would be the blue and the red area here. That's where your spinal cord runs out, and the nerve roots come out back here at each level behind the discs. Now, what you're looking at right there is a disc bulge, and it comes back and it'll bulge and irritate the spine, the spinal cord, and the nerve roots that come out there. So this is where we really start to feel pain, especially if you bend over. You don't have to pick up something heavy. You know, so many times we've heard like, I just picked up a piece of paper and I couldn't get back up because it's been like this for like usually years. And then it's letting you know you need to stop doing something because it's irritating it even more. And then the last picture, the one on the top right here, this is as if we were looking down through your spine. So we cut you in half, top and bottom. And what you're looking at here is the disc, this bubbly looking stuff. And then behind it is some of the bone. So the front of the body is here, as if it were the top of the page. And then the back of the body is here. So the bubbly part is the disc, and it's just showing how the disc would herniate more on the right side. So you kind of have an idea of what you're looking at. Even just a little bit of disc bulge can cause a lot of discomfort. So we're going to go over some stretches for that. And just remember, nerve pain is usually numbness, tingling, or pain that shoots and runs. It's that sharp pain. Muscle pain is usually going to be more achy, And then a strain will be over time. You'll know if you strained your muscle, what you did when you did it. First stretching we're going to do is on sciatic pain. So the first stretch, we're going to start with easy and then medium and how we go to the harder, more difficult aspects. So the easiest one is going to be when you are sitting, crossing your leg. The sciatic pain, or the side that hurts, is going to be the one that you're crossing. So this one is a good stretch, and then you can lean forward for an extra stretch. This is the easiest one. You can also do it at work. Next, the medium is when you lay on your back. You take the affected side of the pain, this side, and you can cross it over to get a good stretch in here. The most difficult one, if you need a deeper stretch, would be crossing it over and then bending the other leg, holding it for this stretch right here. This is called the piriformis stretch, and you can hold it for about 30 seconds. Okay. We're going to do another stretch for sciatic pain. The next one is called, we're going to nerve floss. So, grab the chair. You'd be sitting at your chair. You take the affected leg if it's going down your right or the left. Here it's going down this one. And you can bring your leg out, point your toes, and tilt your head back. And this is stretching that nerve all the way down. Go ahead and come out of it. You will do 10 repetitions and hold for about 5 seconds each. So this is the easiest one to do in the chair. Next, you can do it laying down on your back. So here you can bring your leg up, then point your toes to your head, and this will get a good stretch. If you have a towel at home, you can always have a towel and hold a towel to point your legs down. Hold it for 5 seconds, take a break, come out of it, and then do it again for about 10 repetitions.
Good. So, again, hopefully you all learned a new way to stretch your body, get some motion in your low back, and help relieve sciatic pain. Those stretches might not completely cure your sciatica, but they're definitely a step in the right direction to release some tense muscles, especially in a piriformis, and then actually flossing or gliding that sciatic nerve. If you try that stretch, even if you don't have sciatic pain, it actually feels really good. So if you ever feel tight in your hamstrings or your low back, try that sciatic nerve floss that we showed you. It feels really good. Yeah. Okay. So the next thing we're going to move on to is actually talking about neck pain and the upper half. This is what we call upper cross syndrome. So meaning you have some tight muscles, could be due to posture, prolonged sitting, like for example, behind a desk. And then at the end of the day, we're kind of like this. All of that can lead to the upper cross syndrome. So what we're looking at, there we go. So we're talking about tight upper traps and then tight chest muscles through here. And then when they say weak, like neck muscles and weak trap muscles, it's just because everything's being pulled in this manner. And then we don't have enough strength to actually like keep our body back, right? Because this is so tight, closing things down. So again, that can lead to compensations patterns in our body, which over time will lead to pain, stiffness, soreness, trigger points. And then yes, when we're in this position, it actually closes down our chest and can lead to that hard breath.
So I'm going to show you a stretch for a rounded posture, which will also put pressure in the mid-back area. This is a stretch for people who sit a lot and also feel pressure back here. So what you want to do is you want to get your feet, your hips, your bottom, and your shoulders against the wall and your chin. So try and like give you, or your back of your head. So try and give yourself a double chin and bring everything against the wall. If this is hard, begin here. Hold it and then rest. And then hold it for about 10 seconds at a time and rest. And do it a few times, multiple times. If this gets easier, the next step to make it more difficult and to continue your stretch is to bring out your arms like this, keeping your wrists and your shoulders against the wall. Everything's against the wall, and it'll get hard as you try and bring your hands above your head, and it gets hard for me right about here, and then you come back down and you do another angel. These are called wall angels. Next stretch we're gonna do is for to stretch out your shoulders. This is if you're experiencing some mid-back pain, you've been sitting all day, you need a break from sitting, and this is just gonna help bring your rounded shoulders back. So you can find a door frame. I'm gonna show you one side at a time. You can do both sides at a time. But the first one is making sure your shoulder is even and parallel with your elbow, not too low, not too high. So you want your elbow here, and you're gonna twist away from it and stretch right here in this shoulder joint and open up these tendons right here. Just like that. And then you can also do both sides. So the second side, you wanna have a door frame here, and you want to be against the door frame and do the other side and twist away as well. And hold it for about 10 seconds each.
Another stretch that you can do to help with your neck, and especially if you also have a little bit of a tight chest, is just doing a simple ear to shoulder stretch. So if I have pain or tension on one side or the other, I would go away from it. So let's say, for example, my pain is on the right side, I would actually tilt my head to the left. If I have like a weight or something, I would hold that in my right hand. So whether it's something small, simple, that you would hold to help pull your shoulder down a little bit, and then simply tilt to the left, ear toward my shoulder, and then I would grab with my left hand and pull ever so slightly to get just a little bit more depth into that stretch. And when you're doing this, I would hold that for about 10 to 15, maybe even 30 seconds per side. For me, I like to make sure both sides are even, so I do both sides, but make sure that you definitely do the side that is more irritating. Again, you can simply do this at your desk. The second one that I would do is actually a little bit more in depth, and you're gonna feel it kind of the base of your skull down through a little bit of the back of the shoulder right there. It's called your vater scapulae. That muscle, you would look towards your opposite foot or your armpit, as I like to say, and you would go down. So again, if my pain is on the right, I'm gonna look toward my left armpit, pull my head down just ever so slightly towards that armpit, that down direction. Again, holding that for 15 to 30 seconds. And if you have anything, making sure that if you can, you don't have to, but holding something in your hand to help pull that shoulder down and get a deeper stretch. Again, if you want to go to the opposite side, you would look towards your right armpit, stretching out the left area right through here. And again, a light pull with that hand down towards that opposite armpit or shoulder. Perfect. All right, so
there's a lot of good stretches in there for your neck, for your shoulders. Try them out at home. I like them because they can also be done at work. Like even if you just stand up, stretch your shoulders out, do the door frame, even the wall angels, just things that you can take a break in your day, stand up and stretch it out.
Yeah. And I would also even say sometimes to set an alarm. We all get really caught at sitting behind a desk and answering emails or doing our work. And so it's good to maybe set an alarm to do stretches, take a sip of water, even walk to the bathroom, but just taking a break even to reset your mind as well so that you can be more productive throughout your day. The next thing we want to go through is also some arm stretches, because we do have a lot of people that come in with like carpal tunnel. They get a lot of wrist pain, or they even feel like their grip is weak.
Correct. We're going to go over elbow and wrist. So looking here, we want to show you the difference really quick. Oh, can they see me? So think of, I'm going to come back for a minute. Think of this part of your arm here, closest to you on the inside of your palm. Think of flexors. These are your wrists or your flexors. Think of flexors, fist. So you make a fist with these ones. Well, these are the flexors, and then the extensors are the ones that do this. So we're going to show you how to stretch this side of your elbow, and then also the outside of your elbow. Also known as medial and lateral epicondylitis if you have pain there. So just like in the picture, The one with the palm facing up on the bottom, that's the inner part of your arm. If you were to hug yourself, that's the part that would touch your body. The flexors make the fist, and then the extensors are the ones up top. They're the ones who allow you to open up your palm. Both can be tight. The tennis elbow would be the one on the bottom, and then the golfer's elbow is the one on the top. These are the ones that we talked about earlier. They get tight with repetitive motion. So if you're building something and you're continually like using the screwdriver or something that you have to lock up, these are the ones that get tight. Also, when we talk about carpal tunnel is when you have your wrists up and you're typing for long periods of time. That will really hurt your wrists and ache your elbow as well. So the next stretch we're going to do is if you have pain here in your elbow on the inside, or also here in your wrist or throughout your
And then what I'll do with my elbow is actually like lock that into place so my arm is totally straight. So if you see bent here, and I'd actually rather lock my arm out, and then I'll move my whole body like a pendulum to actually get more motion in my wrist. And really, I feel that right through here and actually getting more mobility through my wrist joints. Perfect. So as somebody who has dealt with that repetitive stress actually on my elbow from doing some pull-ups, I really have enjoyed these stretches. For me, they have really helped just, I guess, help with my grip strength overall, and has helped with alleviating some of my tendonitis that's been going on. The other thing that I actually really love to do is use the magnesium lotion right on that joint, and it really helps actually alleviate my pain within like a couple of minutes of me putting on. It doesn't fix it totally, but it helps for sure.
They also really help the wrists as well.
True.
Next, just going to leave you with some other remedies we've talked about in other talks, but just remember while you're doing these stretches, getting adjusted is important. We have a few things listed. Bone broth is always going to be liquid gold. It has a bunch of amino acids in it. Amino acids are basically the building blocks of life. What that means is they help rebuild muscle. They help repair your joints. They also help your body create more collagen. Bone broth also has its own collagen as well, which also helps repair your joints. And it can also benefit your gut as well. The next one is peppermint oil. There are other oils that you can rub on your skin, usually with a carrier oil like coconut oil or some other oil that you can, jojoba oil. That would be helpful. Use peppermint. There's also menthol. They have those menthol effects. And eucalyptus can also help reduce heat and swelling if there's something of an injury. And then the next one is one of my favorites. I take about 3 to 4 Epsom salt baths a week. I have been working out more and my muscles and my joints are a little bit more sore. So taking an Epsom salt bath and soaking your joints in that will help reduce the swelling and help you recover quicker, especially if you have muscle soreness, and in conjunction with using the magnesium lotion as well.
Another thing that you can do is start making nutritional changes. So what we're talking about really is decreasing the amount of sugars, processed foods, and bad oils in our diet to decrease the inflammation. Decreasing inflammation in our body will help with pain, swelling, achy joints. So just slowly but surely, one step at a time, removing things. For a lot of people, I actually recommend, if you're a soda drinker, to maybe start with that. Do one less soda per day. Just a baby step in the right direction. Again, to remove bad sugars, bad carbohydrates even. So like bread, pasta, rice, crackers, cookies.
Yeah, all that can actually accelerate the aging process. No one wants to age quicker, right? We all want to slow our aging process. So sugar and the bad fats actually make it worse, and they make degeneration happen quicker as well. So we want to make sure to slow that process down.
Another thing that we, along with those nutritional changes, I guess, is weight loss. So for every extra pound that we have on our body adds like 10 pounds of pressure to our low back and our knees. And so just losing 1 pound of weight can actually decrease the load on the low back and your knees. I've had people that have told me they've lost just a few pounds and they already feel a difference like within their low back and especially their knees. And especially during summertime and a lot of people are getting outside and walking and being a little bit more active, it really seems to help. So
find that as an encouragement too. Like if you're in your weight loss journey, we want to encourage you, like, even if you've lost 1 to 2 pounds, you're still helping your low back. You're still helping your knees take pressure off. And remember, your body is healing from the outside. It's not always about the number you see on the scale, but even just getting that oxygen to the rest of your body, your heart, your lungs, it's all helping the repair system of your body too, in your joints.
So good. Yes. And we're here to encourage you guys. So if you need encouragement, let us know, and we're here to help you in any way that we can. We want to invite y'all to our next event.
Oh, we're so excited. Here. We're so excited. Go ahead.
Okay. It's going to be here at our office, August 19th. Sorry, it's a Thursday morning at 9 a.m. We are going to be here at the office.
Doing yoga.
So this is kind of like another next step to, like, maybe you enjoyed some of the stretches we were showing you guys, but you want to get a little bit more in-depth or detailed or even more mobility and flexibility. Yes. Yoga is going to be a really great thing to do. So our friend Janine is going to come and teach the class. It's $10. It will be roughly 45 minutes to an hour, and then we'll provide you guys with smoothies afterwards. And the reason that we're having her come teach y'all is because she came to teach the team like a month ago, maybe, and we just absolutely loved it. It was so much fun, and we felt so much better afterwards, moving all our joints and stretching out everything. So
key things: if you want to sign up, prepay at the office with the $10. Bring water the day of. Also, if you have a yoga mat, bring your own yoga mat as well. They will not be provided. But we're excited to share yoga with you, and Janine is amazing. So